As an audiologist, I come across a lot of different treatments for tinnitus. Good, bad, and sometimes ugly. Depending on the cause of your tinnitus, different treatments may or may not be effective. And today I put together this comprehensive list to make it easier to navigate the different kinds of tinnitus treatments and how effective they are. I'm going to start with what usually doesn't work, but by the end of this list, I'll be focusing on the most researched and promising methods. Lipo-flavonoids. This one might surprise you. Lipo-flavonoids are an over-the-counter supplement. One of the main ingredients is a phytonutrient found in citrus. I heard from many of my patients that their ENT doctor recommends this supplement, but when I looked at the research studies, the results were disappointing. My advice? Skip it. Cortexi. Lots of tinnitus eardrops are sold, and for the most part, they're bogus. There's no evidence that herbal oils or supplements can treat tinnitus. Occasionally, tinnitus can be caused by an ear infection or wax buildup, where a doctor might suggest mineral oil eardrops. But if that's the case, you still shouldn't use Cortexi. Skip it. Tinnitus 911. I'll lump it in with Cortexi. This is a pill with some herbal extracts and vitamins. Don't waste your money. Stem cell transplants. You might be surprised by this one. Stem cell transplants in the inner ear are experimental at best. And if you have tinnitus that may be partially caused by hearing loss, the hypothesis is that these stem cells can help repair damage to the tiny cells in the cochlea, your hearing organ. There are some animal studies that have researchers excited, but in my opinion, it's too early to tell if stem cells will work to reduce tinnitus. I worked with a patient who got an experimental stem cell transplant for tinnitus, and frankly, it did nothing. It was quite a painful experience for him. Now, that doesn't mean stem cells can't work for tinnitus or won't work someday, but I wouldn't hold your breath and wait for it. If you want to hear about experimental therapies with more promising results, stick around until later. Acupuncture. Now, there's some evidence out there that acupuncture can help tinnitus, and I've tried it myself, but a lot more would need to be done to know for sure if acupuncture can reduce tinnitus. I think most promising is acupuncture's use as a way to reduce stress, and what we know is that when we can reduce stress, often tinnitus reduction follows. If you're looking to manage stress better despite having tinnitus, we've got some options coming up that are sure to help. Oxytocin nasal spray. Oxytocin is a hormone that's commonly called the cuddle hormone. This nasal spray has been researched, and the studies I've seen initially seemed promising, but the interest has faded out over time. The Tinitus Patch. This is a skin patch you can grab on Amazon. I'll keep it short. No. Hair cell regeneration. One of the causes of tinnitus is damage to the tiny little cells that vibrate and pick up sound in the cochlea. Researchers are working on different ways to regrow those hair cells. And for some kinds of tinnitus, when you fix the cochlea and those small tiny cells, then you can fix the tinnitus. But traditionally, this research hasn't gone very far. I think it's super interesting, and I hope it works, but I wouldn't expect any kind of breakthrough in the next few years. Tapping. There are some popular videos on the internet that say something like, this one weird hack to cure your tinnitus, and you see people with their fingers behind their head who are flicking their fingers on their mastoid bone. Overall, this will probably not help your tinnitus much, but for my patients, it has given some of them very temporary relief. Basically, what this is doing is creating vibrations through the skull that can reach the bones in your ear that transmit sound. And when you're creating this type of sound for your brain, you're actually doing something that is a form of DIY, do-it-yourself tinnitus masking. CBD. There's studies being done on CBD for tinnitus relief, but in general, I think the marketing hype is outpacing the evidence. Some of our patients at Treble Health take CBD to help them with sleep or manage stress, and they do say it helps a little bit. Earplugs. Some of my patients experience louder tinnitus when being in very noisy environments, and earplugs tend to help. But overall, you should be wary of closing off your ear canal too much, as when you're working on tinnitus treatment, you want to hear all the subtle sounds of your environment, and earplugs can cut them off, so please use them sparingly. Fasting. In my line of work, I hear anecdotes about fasting or the keto diet to help with tinnitus, but there's not much evidence behind this. And I'd recommend anyone considering drastic changes in their diet talk to their doctor, as I've seen it have unintended negative health consequences. Neosensory, a wristband that vibrates while beeping tones are played. I don't generally recommend it for tinnitus, as most of the patients I've worked with who tried it barely saw any changes. Auditory mirror therapy. The basic idea is to flip sounds from the left ear over to the right and vice versa. There's been some super small studies I'm not very optimistic on this one, but certainly commend the researchers for trying and will of course update my opinion if new evidence is released. Mindfulness. If you need help managing stress, this one is definitely worth a try. Mindfulness is something you can do at home or with the help of a trained clinician. It's a mind-body technique that can help change the brain's response to tinnitus and can limit the activity in the part of your brain called the limbic system. That's the part associated with your fight or flight response. If mindfulness isn't interesting to you, we have some more stress relief options coming up. For my patients, when they get set up properly with a comprehensive tinnitus treatment, I often find that those who dedicate their time to mindfulness do better than those who don't. Guided sleep audio. These are soundtracks for tinnitus that can help you fall asleep. You listen to a gentle voice that guides you through a progressive muscle relaxation that can help many drift off peacefully. You can find them on YouTube. If you're struggling with sleep, it's definitely a good and free option to try. Transcranial magnetic stimulation, or TMS. Lots of people understand that the root mechanism of tinnitus is in the brain, and they're curious about things like TMS. Well, this is a non-invasive medical procedure. It applies a series of short magnetic pulses to stimulate nerve cells. It's being studied a lot in the treatment of depression. Now, this is not quite a direct treatment for tinnitus, but I've seen some of our patients who have depression undergo TMS treatment. The results were pretty mixed though. Linear. Linear is a bimodal stimulation device that stimulates your tongue while playing sounds through headphones. We've had a handful of our patients try it at Treble Health, and it seems to help about 50% of the time. But that's just anecdotal based on my experience. Bimodal stimulation in general seems to work better when the tinnitus has a root cause related to your head, neck, or jaw. So if physical adjustments to these areas significantly change the loudness of your tinnitus, linear or other bimodal stimulation devices might be a good option. We've got another bimodal device coming up just in a bit. Biofeedback. Biofeedback is a way to reduce tinnitus symptoms by regulating stress and your nervous system. Basically, a biofeedback session will place sensors on you that measure things like your heart rate and your respiration. When you get stressed, these things naturally increase. While practicing relaxation techniques, you can actually monitor your heart rate and other indicators which create this immediate feedback for how you're doing, hence biofeedback. It's definitely a good option to consider, but not that popular. Cochlear implants. The cochlea is the part of your inner ear that turns sound vibrations into actual brain signals, and damage in the cochlea is a common cause of hearing loss and tinnitus. A cochlear implant puts an electrode into the cochlea to turn acoustic waves into an electrical signal. For those with tinnitus due to severe hearing loss, this is definitely an option. It's an outpatient surgery, so you normally go home on the same day. Hearing devices. Now, many people with tinnitus also have some hearing loss, and modern hearing devices, which can benefit your hearing health and your tinnitus, like hearing aids, should really be considered because I've seen that move the needle for countless of my tinnitus patients. TMJ treatment. The temporomandibular joint, or the TMJ, connects your jaw, your mandible, to the skull and your temple. Tightness in this joint can actually cause problems in some of the nerves that connect to the ear, causing ringing or other noises. While my patients who have tinnitus caused by TMJ disorders still benefit from things like sound therapy and mindfulness, there are specific treatments that can be recommended either by a dentist or sometimes a physician that can really get in there to the root cause of the TMJ. Those treatments can include mouth guards, physical therapy, anti-inflammatory drugs, other medications, and sometimes surgery. If you're curious about what is the root cause of your tinnitus, then you can talk to a doctor or, of course, my team at Treble Health. We're always here to help. Numbers on the screen, just give us a call. Ear surgeries. The stapes is this tiny little bone in your ear that vibrates and transmits sounds. Actually, it's the smallest bone in the body. Sometimes plaque can build up with a condition called otosclerosis, and doctors have to actually remove that stapes. Well, this is an example of a medical condition that can cause tinnitus, and in this case, there would be an ear surgery that could help reduce tinnitus, and it would be a no-brainer for you to consider if that applies to you. Neuromonics. Neuromonics uses music and white noise in a two-stage approach. The first stage just tries to reduce your awareness of the tinnitus with sound, deactivating your fight or flight response. The second stage will gradually expose your brain to more of the tinnitus sound so that it can learn to ignore it, what we call habituation. Neuromonics had some initial success about 10 years ago, but the technology has essentially been replaced by modern sound therapy devices worn on the ears. Medication. Tinnitus can negatively impact mental health, and an increase of stress or anxiety can actually make tinnitus worse. That's why a lot of patients I see have been prescribed anti-anxiety or antidepressant medications around the time that they started to develop bothersome tinnitus. But that's a conversation that really you should be having with your physician. I know that with my patients, sometimes the use of those medications can really help them on their treatment process, but we have to be cautious because certain medication groups are habit forming and we don't want to be on them too long as we're trying to promote the neuroplasticity of our auditory brain. The Michigan Tinnitus Device by Dr. Susan Shore's lab. This is a device that stimulates nerves in the cheek and neck while playing sounds through an earbud. This type of therapy is called bimodal stimulation. Dr. Susan Shore has been doing some really well-designed studies, and her team wants to bring it to market with a company called Oracle. A lot of people are very hyped about this, and if people have tried other forms of tinnitus treatment that haven't worked, I certainly understand why. But I'd be cautious about getting too excited. I certainly think there's people out there who would benefit from this, but the evidence doesn't currently paint this as some miracle tinnitus cure. Sound therapy. Sound therapy lowers your brain's perception of tinnitus by playing sounds or noises, most commonly white noise. The basic principle is to train your brain to reduce its awareness of the tinnitus sound, and sound therapy devices are tuned to your specific tinnitus by your audiologist. This treatment will be helpful for most cases of tinnitus, and my team sees one common thread amongst our most successful tinnitus patients, is that they're using sound therapy consistently until their tinnitus is reduced, and that typically takes multiple months of dedication and fully understanding the theory of what you need to do. There's a few different ways to try it out. Sound therapy devices that go in your ears, which are programmed and fine-tuned by your audiologist, sound machines, sleep headbands, inside of some hearing aids, and some people use their AirPods on transparency mode, which I wouldn't recommend that for more than a few days because we generally want to keep the ear canals open as we're following sound therapy. We do a lot of sound therapy at my telehealth practice, and if you're interested to check it out, just give us a call. We're glad to help. Cognitive behavioral therapy. It might seem weird to recommend seeing a psychologist for ringing in your ears, but cognitive behavioral therapy, or CBT for short, is really helpful for managing tinnitus. CBT uses techniques to reframe the way patients think and perceive things, and in this case, the tinnitus response. And for people whose tinnitus causes a strong emotional reaction, say anger or sadness or frustration or anxiety, CBT is incredibly helpful. Even if you don't go to a CBT trained psychologist, there are lots of CBT techniques that someone like an audiologist can help you with. Tinnitus retraining therapy. This is one of the best treatments for tinnitus out there, according to the evidence. Tinnitus retraining therapy, or TRT for short, combines personalized education, sound therapy, and one-on-one counseling to help you get out of the fight or flight response, which can be a big part of why tinnitus has sustained the intensity of loudness and difficulty. So really, TRT is a comprehensive protocol that combines a lot of things we've talked about on this list. Studies have found that over 80% of patients have a successful treatment with tinnitus retraining therapy, and that's consistent with the patients that I've seen. That's really great. If you have tinnitus and are looking for treatment, make sure you get a recommendation based on the specific root cause of your condition. Now, most doctors will tell you there's not much you can do for tinnitus, or you just have to get used to it. But I'm proud to share that I have a great team who specializes in this, and we can help. Just give the number on screen a call to schedule a complimentary telehealth consultation. I know tinnitus can be frustrating, but it can be treated. So be hopeful, put in the work, and it can get better.